These are our objectives for the day. The first objective is just to make sure that we can define what bloodborne pathogens are, so that we have a clear understanding of the pathogens in the face. We need to identify the workers in our practice who are at risk of exposure to bloodborne pathogens. We want to identify the key aspects of the bloodborne pathogen exposure control plan. And that's a plan that we have written with guidance from Osha. And this is a plan that's written specifically for our office here in this building that can help us prevent exposure to bloodborne pathogens and tell us what's doing even if we do have an exposure. So we'll talk about that. Fourth, we want to describe the methods that we can utilize here in this office to control exposures to bloodborne pathogens. And lastly, in the event that we do have an exposure to a bloodborne pathogen, what steps do we take? So those are the key things that we want to cover with regards to bloodborne pathogens today. There's a lot of material that we're going to cover today, and you may have questions along the line. At the end of our discussion, I'll open it up for some questions. If you have questions, I'll talk about them. If there's more questions than we have time for, you're always welcome to come and talk to me. I'm the person that Dr. Scott has put in charge of OSHA regulations and these types of things. So if you have a question at any time, just come and talk to me, okay? So, bloodborne pathogens. Bloodborne pathogens are any microorganisms that have the potential to cause disease that are in human blood. There's a long list of bloodborne pathogens. There are hundreds of bloodborne pathogens that are out there. Most of them are really not a concern to us in dentistry. And every once in a while you'll hear in the news, there will be a big story about the bloodborne pathogen of the day, whether it's Ebola, or the Zika virus, or mad cow disease. These are all pathogens that can be in the blood at any given time that typically aren't a risk to us in the dental profession. They're very rare. Oftentimes they're not found in the United States, and they're typically not a concern to us. The bloodborne pathogens that we're most concerned about in dentistry are hepatitis B, the hepatitis B virus, the hepatitis C virus, and HIV. So hepatitis B. Hepatitis B is a virus that studies show that it infects about 1 in 20 people. It's frequently a silent virus. A lot of people don't know that they have hepatitis B. When it does have symptoms, they usually include jaundice, which is yellowing of the skin, yellowing of the eyes. It can cause abdominal pain, nausea, vomiting, fatigue, loss of appetite, sometimes weight loss. Those are all signs of hepatitis B. Hepatitis B can progress to become a chronic liver condition. It's a disease that affects the liver. It can become cancerous, and in some people it can lead to death. So hepatitis B is a very serious infection. Fortunately, there's an immunization or a vaccine for hepatitis B. And I'm guessing that most of you, if not every single one of you, have already been vaccinated for hepatitis B. If you don't know, or if you haven't been, talk to me. And when you were hired, there was paperwork that dealt with this that you should have already signed when you were hired and talked to Katie. So if you're unsure if you've been immunized for it, be sure and let me know. Okay? Hepatitis C is similar to hepatitis B. It is actually the most common chronic bloodborne infection in the U.S. And again, a lot of people who are infected with hepatitis C don't know it. Okay, so when we are looking at medical histories, when we're working on patients, keep that in mind. You know, when we're working on patients, they may not have any conditions listed on their form, but we need to be mindful that they may be. And we'll talk about that a little bit later when we talk about universal precautions. Symptoms for hepatitis C, if a person has symptoms, are similar to the symptoms for hepatitis B. Jaundice, nausea, vomiting, weight loss, loss of appetite, those types of things. Okay? And like hepatitis B, it can become a chronic condition, and if untreated, it can lead to death. Hepatitis C now has, there's no vaccine for hepatitis C, but there are treatments that are available for hepatitis C. And it can be controlled and even cured with treatments. The last of the three viruses that we're concerned with typically is HIV. And HIV, as you know, is the virus that leads to AIDS. A lot of people, 20% of people with HIV don't know they're infected. There's no vaccine for AIDS or for HIV. Fortunately for us, as healthcare workers, HIV does not survive very well outside the body. And when I say that, I mean a very, very short time that it can survive outside the body. It's very difficult to contract HIV from a needle stick. Centers for Disease Control, which is a government agency, report that if you suffer a needle stick from a person that has not just HIV but full-blown AIDS, if you have a patient that has full-blown AIDS, you've used a syringe on them to anesthetize them, you stick yourself with the needle, it's a less than 1% chance that you will contract HIV. In fact, the numbers I've heard that it's a 0.3% chance, so 1 chance in 300 that you would contract HIV. So it's a very minute chance that you would contract it, but we want to do everything we can to make sure that we don't stick ourselves and we don't expose ourselves to that virus. Okay, so let's talk about the risks of exposure, things that we do or areas that we can become infected or exposed to these pathogens. In dentistry, the main source of infection for us is blood that we deal with every day. We're fortunate in that regard. In medicine, the physicians and nurses that are dealing with patients have a tougher task to protect themselves from these bloodborne pathogens because they are present in almost all human body fluids. So these diseases can be spread as a sexually transmitted disease. They can be spread in fluids that we don't deal with every day. Cerebrospinal fluids, synovial fluids, peritoneal fluids, amniotic fluids, things that we just don't deal with in dentistry. So we need to be primarily concerned with blood, and we need to keep in mind that saliva frequently is contaminated with blood, especially in a person that has gingivitis. In a case where we're doing oral surgery, the saliva is going to be contaminated with blood. So with us, we need to be primarily concerned with saliva and blood. Okay? What are the risks, or what are the potential things that we do every day that can cause an exposure? Any comments?
Scaling teeth.
Scaling teeth. So scalers, needles, high speeds with burrs. Tafelmeyer, yeah, that's true. If there's times when I push on a Tafelmeyer to see it down, it can cut my glove and potentially cut my skin. Anything else?
Sharp teeth.
Sharp teeth.
Or fractured.
Right. Yeah.
15 12.
Yeah, blades, sutures.
Aerosols, like if you're not wearing masks.
Right. These are all things that we need to be considering, splashes, you know, and it can be something that you wouldn't even think would be possible. I don't know how many times I've been flossing teeth and the floss will flip saliva, blood onto my glasses. So we need to be mindful of the things that we do that we might think don't really require us to be wearing our protective equipment that can put us at risk. So be mindful of all these things that we do every day that can put us at risk and be careful of that. These are some interesting graphs that I came across to talk about risk of exposure. The one on the left is a pie chart that shows the different occupational groups that reported needle stick injuries, or more appropriately, bloodborne exposure to these viruses. And this was back in 2008. I would think it's pretty similar to what the statistics are in 2018, 2019. But dentistry accounted for only 1% of all of the reported exposures to bloodborne pathogens, whether it's needle stick, a splash, whatever the exposure is. Dentistry only accounted for 1%. And that includes dentists, assistants, hygienists. That's for the entire profession, okay? Those that are at greatest risk or reported the greatest number of incidents were nurses at 44%, physicians at 28%, and technicians at 15%. So when you look at our risk compared to the medical profession, I think we do a pretty good job of protecting ourselves, and we really don't have, comparatively speaking, a very high risk. Okay? So let's talk about this. I mentioned this briefly, our exposure control plan. This is something that we, as I said, prepared specifically for Summit Dental. This is something that's accessible to each of you. It's going to be kept in the first aid cabinet in the sterilization lab, and you're free to go and look through it. If you have any questions about the things that we're talking about today, this is a living document, so we will review this annually, and we will make changes to it. As new technology and new equipment becomes available to us that can make our jobs safer, we will have the opportunity to incorporate that into our plan and make it available to each of us. So I will be working with Shar and Amy and the assistants and the hygienists together to figure out ways that we can make our work environment safer and less risky to the exposure that we face. And as we do those things, we'll incorporate it into this exposure plan. Okay? So one of the first things that we can do is to make sure that we are taking universal precautions. That's the way I learned it. The term that I used was universal precautions, which essentially means that when a person walks through our door, no matter who they are, we treat every person as if they are potentially infectious. So we treat every person, and this is not in a negative way, but we treat every person as if they have one of these three conditions that we're concerned with, okay? And what that means is if we treat each person the same way, and if we're prepared for that, then our risk is going to be quite low. What are the things that we use every day to make sure that we're safe? Gloves, masks, eyewear, what else did I hear? Lab jackets, surgical smocks, those are the things that we can use every day. Okay? Proper cleanup and decontamination. One of the things that is in this book is a schedule of cleaning. The most important cleaning and decontamination that we do every day is going to be in our operatories. And of course, we do that after this patient. And we'll continually be getting training on the proper way to do that and the proper materials that we use. Okay? with regards to universal precautions. Let's say a person comes into our office who is HIV positive. What can we do differently for that patient to protect ourselves? Nothing.
Good answer.
Okay, can we double glove for that patient? Can we put 2 masks on? We don't need to. Universal precautions, the way that we protect ourselves with the gloves that we have, with all the PPE that we provide in this office. Gloves, disposable masks, eyewear, lab coats, surgical smocks, disposable smocks if we're doing certain procedures. Those are all sufficient to protect us, and if a person comes in with a known blood virus, we cannot do anything different for them than we do for anybody else, and we really don't need to, okay? What are some engineering and work practice controls that we use to protect ourselves? What do we do with a needle, for instance, to recap it, to make sure that we don't poke ourselves? There are some things out there that we can do. We don't utilize all of them. We can change that if we choose to. But what are some of the things that we do now? One-handed cap. Okay. Never ever hold the cap in one hand and the syringe in the other hand and close it with 2 hands. That's a very risky way to recap a needle, and if we're doing it that way, it's inevitable we're going to poke ourselves. So currently, our engineering and work practice as far as recapping needles is the one-handed technique. Put the cap on the table with one hand, scoop the cap, and then grab the cap beyond the tip of the needle to finish putting it onto the syringe. That's our technique for that. We provide sharps containers in every operatory and in sterilization. Ideally, the needles, the sharps should be disposed of in the operatory that they're used in, rather than carrying it from the operatories into sterilization.
We've got one of those in every operatory, correct?
Yes.
And is that what we currently do?
Yes.
Perfect. Good job.
SHAR will be assigning, one of the things that we need to do is we need to make sure that they're not full, so that when they need to be used, we can ensure that we can safely deposit any sharps into that container without them overflowing. Do we currently have someone assigned to that? Okay, so that's something, again, this is a living document. I'll be working with SHAR to make sure that somebody is assigned on a regular schedule to check the sharps containers, and when they're full, to replace them with one that's empty and won't put us at risk. Okay, so that's an example of how we'll be, this is fluid, and we'll be making changes to it as we go. Okay. The single most important thing that we can do every day to control exposures is wash hands. And it's highly underutilized, not just in dentistry, and not just in our practice here, which it is, but throughout the medical and dental professions. So, hand washing with soap and water after every patient is the single most important thing that we can do to prevent spread of bloodborne pathogens. And recommended hand washing technique, might be tricky to do on a really, really busy day, is 20 seconds. Vigorous scrubbing with soap and water. So sing the happy birthday song twice in your head, not out loud, and that's 20 seconds. Okay? So hopefully we'll see more and more hand washing as we, yes.
Another method is hand sanitizer.
Yes.
And that's what most hospitals are going to for compliance reasons.
Right.
And consistency. And we should have hand sanitizer at every clinical workstation. Do we have any up front? Just like
Yeah.
There's some on the counters.
So
If you pass the Summit logo on it.
Thank you, Kenzie.
So obviously, in between, when you're in a clinical room, we should always be sanitizing our hands when we leave the clinical room, come back. That should be a very frequent thing.
Right, and in the clinic, next to each sink, there's soap and there's hand sanitizer. If you're noticing that one of the hand sanitizers is out, let us know. Or if the soap is out, let us know. Is it the janitors, is it the janitorial staff that resupplies with Scott?
No, I think we do that.
We do that?
I think,
I heard somebody say Kenzie's name, is she here?
No.
She's not here? Okay. Since that came up, this is our attendance for today's meeting, and each year when we have these meetings, we're gonna record attendance. So I'm gonna pass these around. And if you could just sign this to show that you have attended our course today. Okay, so these, I don't know if you knew, there's new recommendations for PPE for 2019 that we're gonna make. These are, and we kind of touched on it briefly, these are the things that we provide for PPE, and they are sufficient to protect us from the things that we're talking about. Disposable gloves, disposable masks, eyewear, clinic jackets, and surgical disposable smocks. Now, we need to use our heads. We don't need to go into exams and trophies with surgical smocks on. But we need to make sure that the PPE that we're using is appropriate. And times when we think for an exam, we may think for an exam, do I really need to wear glasses? Well, yeah, because during that exam you might pick up a piece of floss to check a contact because the patient's complaining that they're getting food stuck down there. And like I said, you floss their teeth, and the next thing you know, there's splatter from the makes it into your eye or onto your mouth or into your nose, and you have an exposure. Okay? So gloves, masks, eyewear for splash protection, clinic jacket, and liquid-proof disposable smocks. Okay. So our responsibility as providers, again, is to properly wear the PPE as we've been trained, to attend training as you're doing, and as things change, we'll need to change our training. And then we need to care for, clean, and maintain our PPE. If there are glasses that are broken, or they're insufficient, or they're scratched, so you can't see very well through them, let us know. So we can get you good, quality, protective equipment that will prevent any problems, and notify us when that needs to happen. So other ways that we can control exposures. Housekeeping, as I said, we have a written schedule for cleaning the equipment, for cleaning the operatories, and those things may change. And if they do, Star will notify you. In dentistry, there's not a lot of situations where we can break glass, a vial, or whatever is typically contaminated with blood. But in the event that we do break glass in the office, regardless of whether it's contaminated with blood, we never pick it up with our fingers. Whether our hand is gloved or not, we always use mechanical means, a dustpan, and a broom to prevent any wounds from broken glass. Okay. As far as cleanup and decontamination, obviously we wear protective gloves while we're cleaning. We use an appropriate disinfectant. We use capsicide, glutaraldehyde-based disinfectants that are very effective for cleaning and controlling these viruses. However, they don't work really well if there's a gross spill of blood, or if there's a puddle of blood, which rarely we have those situations. But in the event, if we had a particularly messy surgery and there is gross contamination of blood on a light handle or a handpiece handle, those areas need to be cleaned with soap and water prior to using the glutaraldehyde. When you have a gross specimen of blood, the glutaraldehyde isn't as effective at disinfecting that. So we want to clean that first with soap and water before you use the cabby wipes on the surfaces. Okay? When we're done cleaning the rooms, again, wash up either with soap and water or with the hand sanitizer. And then properly dispose of our contaminated personal protective equipment. How do we properly dispose of PPE? We properly dispose of it by removing it safely. So if we've done a surgery and we have a smock on that has blood splatters, it's not a good idea to take our gloves off first and then grab our smock with our hands and pull it off, or take our gloves off and then grab our mask with our hands and take it off. Always make sure you remove all those first and then remove your gloves carefully. And as you remove your gloves, make sure that we're not grabbing the glove with another gloved hand and wiping across our skin with the glove. Make sure you grab your glove in a way that you don't touch your skin with the gloved hand. And then once this hand is clean, reach underneath the second glove to pull it off. And then as you pull them off, turn them inside out and then dispose of them in the trash receptacle in the room you're in. Okay? We never dispose of PPEs in the restroom trash cans, in the break room trash cans, in the business office trash cans. And we never go into the waiting room and reception area with PPE on, other than our lab jackets. Okay, no masks, no gloves. Okay.
We never do that, right?
Why don't we do that?
Well, because the ladies up front do not want to be exposed, and the patients up front do not want to be exposed to these viruses that could be on our personal protective equipment. We're not routinely sanitizing those surfaces up there like we are our operatories with fluoraldehyde. Yeah,
Also, the patient doesn't know whether they're clean or dirty,
that's true.
so we don't want to give.
Go up with
perception
clean
of
gloves.
dirty.
Exactly. That's a good point, Tammy.
Same thing reaching into drawers and stuff like that, right?
Exactly, right.
Could be clean gloves, but nobody knows that.
That's true.
Yeah, I'm not gonna lie, when I see you guys with gloves on and you're like doing something else in that weird spot, like I think they're like, I wasn't clean my hair, but that's the first thing that pops in my head.
Right.
Doesn't look good.
I think we talked about this not too long ago. Our trays should have 2 pairs of cotton pliers in them. And if we need to get something out of the drawer, we either need to take the glove off, get into the drawer to remove it, or we can use the clean cotton pliers. The trick to that is we need to make sure that we know which one's clean. So we need to be mindful, make sure that we don't cross-contaminate things and put each other at risk. Okay? Regulated waste disposal. This is, again, something that is going to be rare in a dental facility as opposed to a medical facility. Okay, so some of the definitions of regulated waste are liquid or semi-liquid blood. So after a surgery, there may be pools of blood that need to be disposed of in a medical setting. There may be large quantities of clotted blood that need to be disposed of. We typically don't have that. There may be, in an emergency room after an accident, there may be towels or large pieces of gauze that are saturated with blood that dry, that blood gets caked on it, and when you move it, that caked on blood can flake off and contaminate the floor and all the surfaces around. We typically don't have that in a dental setting. Or pieces of gauze that are so saturated with blood that if you were to compress it, it would drip. We typically don't have that in dentistry. In those, yeah, Shar,
I just mentioned, we do have throw up.
vomit,
Yep. Is
yeah.
that right?
We do, and I don't know the answer to that. If we need to, do you know if vomit needs to be, probably not. Probably doesn't need to be disposed of in any other way than.
We'll do a little bit of research. Obviously, that's a different material,
Yeah,
but let's do research and see if we need to do anything different.
we can look into that.
I think with vomit, we do pretty good at keeping our distance from that as we. But it's a good point, so let me let's do some research and find out. I don't know the answer to that.
Okay.
What about when the chair leaves? Just, sorry.
That's happened once in our, okay, I digress.
All right, good story there. So, in the rare event you have any of these three situations where there's a gross amount of blood that needs to be disposed of, that can't just go into the regular waste basket, we do have some small hazardous waste bags that can be sealed. So if you had a piece of gauze that was completely saturated with blood and it was dripping, we can put it in a small hazardous waste bag, and then it can be closed and it can be disposed of in the trash. Yes.
Sometimes when I have that, I'll just put it in a glove and then tie the glove up and then throw it in the trash can.
Okay. All right. And then again, dispose of contaminated sharps in disposable puncture-resistant receptacles or sweetener. Okay. Laundry. So we cannot take our PPE lab jackets home to wash them at home. We have a washer and dryer here that's been provided for us to use. And there is a laundry receptacle in the supply room to place those. When your turn has arrived to take care of the laundry, when you're moving the laundry from that bin to the washer, please use gloves. Have some gloves back there that you can use. That's potentially contaminated material. We need to use gloves to put that in the washer. Okay, so a very, very effective way that we've talked about to prevent exposure to hepatitis B is with the vaccination. It's offered to every employee. Again, if you have not had it, let us know. It's provided at no cost to employees. Ideally, we would provide that to you within 10 days of hire. The only way we wouldn't do that is if you decline to have it done. And if you decline, then we would have a form for you to sign. If you decline it and then decide that you want to have the vaccination, we'll provide it for you. So any of you, if you haven't had it and you want to have it, let us know and we can provide that for you.
That's not something you have to do more than once, right?
Typically not. There is a booster. You can be checked to make sure that it's still that you're immune, and if you're not immune, then you can be revaccinated. So you can check for that. There currently aren't any vaccinations for hepatitis C or HIV. Okay, so let's talk about when exposure occurs. Again, we've talked about it already. Needle sticks, we can be stuck or cut by any number of sharp instruments that we have. One that happened to me